My name is Sabrina Strickland. I'm an orthopedic surgeon specializing in sports medicine. The vast majority of the surgical cases I do are more complicated knee surgeries.
I'm Andreas Gomoll, her husband, and practice partner. I do sports medicine, heavy focus on knee and complex knee.
We actually met at the International Patellofemoral Study Group back in 2015. About 90% of our practice is the same. There's a few things you do that I don't do anymore, and the same.
Versa. We have this built-in consult ability of someone who's really smart, she's really good, she publishes a lot. I don't have to email or call a friend. We can talk over dinner, and patients, they think it's the coolest thing.
And sometimes we do surgery at the same time. So, like I suggested to a patient yesterday that I'll do 2 parts and you could do 1 part, and the patient's like, really? That sounds awesome. So I think it makes it also a much more efficient surgery. The very first FDA trial I did was actually a placental stem cell or placental extract, if you will.
Yeah.
And patients really like that you offer something new and cutting edge.
I love my job, but having this other aspect of it, that's a little bit more a development type engineering, is great. And then you follow that through the trial, and then the FDA approves it, and then it's in clinical practice. And there's a certain kind of joy in seeing that and making new things available.
So CartiHeal, we were part of the FDA trial, and that is coral from the sea, as I tell my patients. And you're basically taking these little plugs of coral and you're filling cartilage defects in the knee. And then over time, what we have seen is that cartilage grows overlying those plugs.
MISHA is a shock absorber. It looks like a car shock absorber. It's much, much smaller. Of course, it's the diameter of a pencil. And it's for anyone who has medial compartment, so the inner rather than the outer side of the knee, that has cartilage damage, arthritis. And not the kind of arthritis where we say, oh, the best way for you to get better is with a knee replacement, but you're young, you're active, knee replacement is not ideal for you. So,
and young could be 60.
Yeah.
I mean, young keeps getting younger.
That's true. So we should say physiologically young. So not what's in your driver's license, but how do you feel, how active are you?
Hyalex is a product that we first heard about at a sports meeting about 4 years ago. It is a synthetic cartilage and it's metal backed, so there's no human tissue. We're extremely excited about this product. We now are entering the pivotal trial, so there have been enough cases done so that the safety has been established, that it's certainly not doing any harm, and patients so far have felt remarkably good, and they've also felt remarkably good remarkably quickly.
Yeah.
And so this could be something that could really, I think, transform orthopedics.
Now the next trial coming up, so babies are born and mothers store the blood and part of the umbilical cord in case the baby at some point maybe has leukemia, needs a stem cell transplant, and they can get it with their own tissue.
Which I stored my 3.
Yeah. Then they started to branch out a little bit, so now they're using these blood samples and they take stem cells out and they select the ones that want to become cartilage. And then the surgery is you get these stem cells, you mix them with what's called hyaluronan. It's a molecule that exists in the knee joint, and it's sort of joint grease, if you will. And it forms a gel. And then for the surgery, you drill holes into the bone, larger size holes, and you fill these holes with the stem cell gel. So they may have one defect, but the rest of the knee is a little worn too. And because you introduce stem cells into that joint environment, the rest of the joint settles down and that main defect heals. That's the next frontier, and that will happen, I think, in the next year or so.
When we first started working together, you used the word joint preservation, and I kind of made fun of you because I'm like, what do you mean? But I have to say I've completely adopted that phrase, because ultimately, what are we doing? Even if I'm doing an ACL reconstruction, I'm trying to preserve that knee so that boy or girl or man or woman can get back to what they want to do and hopefully preserve it for the future. Every day I probably see 5 to 10 new patients in clinic who have already had surgery, or at the very least have had another opinion or 2. So I think we have an unusual referral practice because patients often come to us after they've tried other things that just haven't worked.